Hi, it's Dr. Lewis Clark. I want to thank you for joining me on this journey of how to save your brain. I'm going to be honest with you, I'm super excited about this series of videos to help you understand how to prevent early brain decline. Talking about early brain degeneration or cognitive decline. And there are some things that can be done, and there are some things that must be done in order to prevent this process. Because the facts are, as you're going to see in these videos, that these problems are increasing rapidly in our society. As a matter of fact, you probably already have someone in your family or in your close friends that have been affected by early brain degeneration and cognitive decline, and possibly even a neurodegenerative disease like Parkinson's or Alzheimer's or something of that nature, or dementia. So with that said, we're going to get right into it today. If you don't know me, I'm Dr. Lewis Clark. You can see my credentials. I'm a board certified chiropractor since 1992, been in practice for almost 30 years at this point, helping people to improve their health. I'm also board certified in integrative medicine, and I'm a certified wellness practitioner. So what's going to be covered in this series of videos? First of all, how does the brain work? Okay, what kind of causes to brain decline, and what are the risk factors that may be in your life that need to be addressed? And then what can be done to maximize your brain's health through integrative medicine and functional neurology. So that's where we're going with this. And I want to give some thanks to Dr. Tatis Karazian, and there's an example of his great book about why isn't my brain working. And I've learned a lot from Dr. Karazian, appreciate his influence in my life. And so let's talk about, first of all, some of you have probably already, if you've got symptoms, which we'll go into of cognitive decline, you've probably already maybe gone and talked to your doctor about it. Maybe you've even had some testing done, some imaging, like maybe an MRI, and the doc came back and said, well, hey, everything's normal. What does that mean? Well, here's what that means. As you can see right here, we have what's called hard lesions. These are STDs. These are things that medical neurologists deal with. And so these are strokes and tumors and diseases. These things do have positive findings on imaging, and they have obvious outward presentations, maybe like a stroke posture or something like that. Versus what we deal with over on this side of the screen is soft lesions. Okay, soft lesions, they're not going to have findings on imaging. MRI is going to come back and say basically it's normal, or at least it's going to show something subtle that the medical doctor is going to dismiss as normal aging. And that means that your problem is not anatomical. It means that you haven't lost a part of your brain anatomy, but you've lost function. And that's the difference. So those exam findings are more subtle, requires a different type of exam. The problems are functional in nature, and they must be dealt with by a functional neurologic approach, not a medical neurologic approach. So with that said, let's address some of these symptoms of a soft lesion or a functional neurologic lesion or problem. So we're going to go through the most common for adults and for kids, but one of the most common things, obviously, across America right now is depression and anxiety and insomnia. And those are brain-based problems, by the way. And guess what? In the last year, I'm doing this video right here in June of 2021. Guess what? In the last over a year now, we've been going through the effects of this COVID-19 virus and the government shutdown and everything has happened with that. And guess what? Depression and anxiety and depression drug prescriptions have gone up over 30% already, and it's going to get worse. So these are brain-based problems. Memory loss, of course, everyone's concerned about when that happens. Brain fog, That's the kind of thing where you just don't think clear. You can't remember where you put your keys. You know, things are starting to happen that are weird to you. You haven't had before. Chronic headaches, trouble focusing and paying attention, losing your enjoyment of life and your motivation in life and your social life. Those are big ones. And I'll tell you, impulsivity is really big as well. So these are some of the things that happen on our emotional side, but look over on the other side of the screen here. You're going to see things like vertigo. Okay, and that is definitely a brain-based problem. Weakness or numbness and tingling in the hands or feet or in your face, trouble following directions, digestive problems. Realize that every organ has to be turned on by your brain and nervous system. And the biggest part of your nervous system is as far as going to organs goes to your digestive tract. So a lot of times brain-based problems show up as constipation or bloating or indigestion or even reflux. Then you got blood pressure problems, all the other things that we've already talked about there. So how prevalent are soft brain lesions? Oh my goodness, let me tell you, they are rampant. And look, there are people long before they're diagnosed with one of these degenerative neurologic diseases that are having symptoms. I'm talking about 5 or 10 years in advance of getting a diagnosis. By the time you get a medical diagnosis of Alzheimer's or Parkinson's or dementia, you have had a problem developing for a long time. And once you have that diagnosis, you know that there's going to be some permanency. And at that point, the focus completely changes from trying to get this removed to the point of just trying to stop its progression, trying to slow it down. So it's affecting all ages. Even kids are having more problems today as well in these functional brain lesions. So let's go into now, what does a healthy brain need? Well, it's got to have fuel. And the fuel supply to the brain is glucose levels being stable and oxygen. These two are critical. Without that, the neurons cannot function. The next thing it needs is proper neurotransmitter levels. And there are different types, and we're going to get into that in more detail. And then it needs activation or stimulation. That means that there must be input from your body and from your environment, stimulating the brain to keep the brain working optimally. Your brain is a lot like a battery, okay? If it doesn't get recharged, it runs down. And then we need an inflammation-free environment. And I'm going to tell you, if you're hoping that maybe that drug, that prescription, or maybe there's some other magical prescription is going to help you with this, I'm going to tell you that your symptoms will not go away with drugs long term if you have one of these underlying problems going on. So these must be determined, they must be addressed. So now we talked about what the brain needs. Now let's talk about how the brain functions. So your brain is always firing within itself in order to keep the brain working optimally. So I'm going to show you kind of what this looks like right here, okay? So input from your body comes into the brain, into the cerebellum. So you see this here. So for you to hear me, there's going to be some processing there, but especially anything you feel, any movement that you have, the effects of gravity, just about every nerve ending is going to come into your nervous system and end up coming into the cerebellum. After the cerebellum, there's going to be a firing into the cortex of the brain. So now the right cerebellum will fire into the left brain and vice versa. After that, and that's going to be up into the frontal lobe and your parietal lobes in particular. So that's where decisions are being made. That's where interpretation of this signal that the cerebellum has received is going to be processed. And then there's going to be from there a stimulus sent down into the lower brainstem, particularly the medulla oblongata and the pons. This part of the brainstem is parasympathetic, and that's very important when we get in here just a little bit deeper. So after that, this lower brainstem is going to inhibit the midbrain from firing. And that's very important because in your midbrain is your sympathetic system. So if we have a misfiring of the brain, if we don't have input, or if we have some input that's being blocked, now the signals can't get from the right cerebellum to the left brain. So then therefore the lower brain stem does not get activated or stimulated, so it cannot block the midbrain. So guess what happens? We have what's called a sympathetic escape, or an overfiring midbrain, which is also called the mesencephalon. When that happens, you go into a emergency state, and the emergency state is going to have a global effect on your body, and it can affect all the different things you see here on the screen, from causing migraine headaches to having rapid heartbeat or AFib, from shutting down your digestive tract or going back and forth between constipation and diarrhea, more pain, and even fibromyalgia, urinary tract infection because you can't empty the bladder completely, insomnia and fatigue because you don't sleep well and your energy doesn't get good during the day, and even light sensitivity. These are all caused from one problem, which is brain-based. And how is this typically treated? By prescribing all these different types of drugs. So you can understand now why in our society we end up with a growing list of drugs, bigger and bigger and bigger, and it's never addressed the underlying problem. So our approach is different. And now, one more thing I want to make sure you understand is that the brain, okay, needs proper metabolism. And what does metabolism mean? It means that you have the ability to eat food and make energy. If you can eat food and make energy, you have good metabolism. If you don't, you have decreased energy production. And when that happens, what organ do you think is going to be affected the most? Well, the one that needs the most energy, which just happens to be, if you haven't figured it out already, your brain. 30% of our glucose and oxygen are necessary for running your brain. It is very energy demanding and is doing a lot of things, and most of those are completely unconscious. You have no conscious awareness of those. So with that thought in mind, we're going to transition now and begin to talk about our next video. How do you know if you have a brain-based problem? That is what we're going to discuss next time. I'm going to give you the ins and out of that, how to know if your problem is coming because your brain is beginning to decline. And then in the last videos, we're going to give you some instruction of how do you begin to reverse this process. What action steps do you need to take? So our next episode, as you see, June 17th. And if you haven't already, be sure to subscribe to our YouTube channel. Click the bell so you can get the notification when that happens. Follow us on Facebook. We're doing live videos on there frequently, usually weekly. So you want to be sure also that you can get those as well. So until next time, live life well, keep your brain safe, and God bless.